Hello and welcome to New Student Orientation. My name is Karen Ross. I am the Associate Director of Student Health and Wellness, which is a department within the Office of Student Affairs. Part of the responsibility of the Office of Student Health and Wellness is to oversee insurance and immunization records, which we will focus on today. But first and foremost, before I jump in, I just want to congratulate you all on becoming part of the Teachers College community. So what are we responsible for within the Insurance and Immunization Records Department? Well, for one, we're responsible for ensuring all Teachers College students achieve compliance with New York State immunization requirements. We're responsible for managing enrollment for Columbia Health and Columbia Student Health Insurance plans. We provide general information and administrative support for Columbia Health and Columbia Student Health Insurance plans. And finally, for planning and implementing health and wellness programming to the Teachers College community. Important dates to remember, which I will mention throughout the presentation. First, August 15th, 2020. That is the date that coverage begins under the Columbia Student Health Insurance Plan. September 2nd, 2020. That is the deadline for new students to submit their immunization records. However, please keep in mind that for students that will reside on campus, you have to hand in your immunization records before you actually move in. And lastly, September 30th, 2020 is the last day to either enroll, to waive, or apply for an exception to the Columbia Student Health Insurance Plan. So the topics I'll be covering today are the Columbia Health Fee, the Columbia Student Health Insurance, and immunization records. So what is the Columbia Health Fee? Well, the Columbia Fee allows you access to the Columbia Health services, such as routine health matters, ongoing health conditions, and well-woman gynecological services. There's also counseling and psychological services available, Alice Health Education Programs, which provides a wealth of information and a wealth of programming to the students, and nutrition services. Who pays the Columbia Health Fee? I will mention several times during this presentation that there are 3 mandatory categories that apply for students in terms of the Columbia Health Fee, which also applies to the Columbia Health Insurance Plan. So the first is students who are full-time taking 12 or more billable credits. 2, students who reside within Teachers College residence halls. And 3, international students, regardless of your credit status. Full-time students who waive the Columbia Student Health Insurance Plan are still required to pay the Columbia Health Fee and are automatically enrolled. This is true regardless of your health insurance plan, and the fee cannot be waived. Part-time students who are taking fewer than 12 billable credits are not required to pay the Columbia Health Fee. However, they may request the fee to have access to the great benefits it offers by contacting us at health-immunization@tc.edu. And please also note that Columbia Health Fee is applied and billed during fall and spring semesters. Health insurance. So the Columbia Student Health Insurance complements the Columbia Health Fee for services not covered at Columbia Health. So keep in mind, these are services that you will receive outside of Columbia Health or outside of CPS. It's offered through Aetna Student Health, and it covers pharmacy benefits, lab costs, x-rays, inpatient, outpatient hospitalization, and the list goes on. For the 2020 to 2021 academic year, Columbia University offers a single platinum level plan to meet the students' health-related needs beyond on-campus services offered by Columbia Health. And here are just a few of the highlights. Deadline. As I mentioned earlier in the presentation, one of the dates to pay close attention to is September 30th. This is the last day that you will have to either enroll in, request a waiver for, or apply for an exception to the Columbia Student Health Insurance Plan. Enrollment after the deadline, meaning after September 30th, will only be considered if a student loses health insurance coverage through a qualifying change of life event. Students who wish to add the Columbia Student Health Insurance must contact us at health-immunization@tc.edu within 30 days of losing their insurance. And of course, again, for those who would like to enroll voluntarily, you may do so through the MyTC portal. And this is for anyone who is registered within any degree granting program. So note that this does not apply to students who are at TC for Certificate of Equivalency. And this is just a chart to show the fees and the period of coverage. So it begins August 15th, 2020 and ends August 14th, 2021. Also note within the chart, the fall premium under the Columbia plan looks different from the spring premium because the fall premium only covers August through December, while the spring premium covers January all the way up until August when the plan ends. Insurance referral policy. Except for visits to a hospital emergency room or an urgent care facility, a referral from an on-campus medical services or counseling and psychological services provider is required in order for students to utilize the off-campus benefits available under the Student Health Insurance Plan. So providers at Columbia Health Medical Services and Counseling and Psychological Services provide referrals after evaluation and treatment on campus has been completed and as the need for outside services is clinically indicated. You do not need separate referrals each time you see the same provider for an ongoing condition. So where can you go? So John J. Hall Medical Services and Alice Health Promotion, they're located on the 3rd and 4th floors of 114th Street and Amsterdam Avenue. Counseling and Psychological Services, also known as CPS, located on the 8th floor of the Alfred Lerner Hall, as well as Sexual Violence Prevention. And should you need medical services, emergency medical services, the closest ER is St. Luke's Hospital. So again, with the 3 mandatory categories for enrollment, that is all students who are registered for 12 or more billable credits, also known as full-time, students who are living in residence halls, and international students regardless of your credit status, you will automatically be enrolled in the Columbia Student Health Insurance Plan and be charged for the Columbia Health fee. Enrollment is on an annual basis and the fees will be applied to your student bill during fall and spring registration. If you are enrolled in the fall, you cannot drop or change your coverage for the spring. If you meet the criteria for automatic enrollment, you will be enrolled for the entire year, regardless of when your registration takes place. Fall 2020 insurance rules. So again, I'm mentioning the 3 mandatory enrollment categories for the Columbia Student Health Insurance Plan. 1, all full-time students, all students residing in TC housing, and all international students. However, for those students within TC residence and for full-time students that are domestic, meaning you reside in the United States, you will have the option to waive the Columbia Student Health Insurance Plan once you can show that you have comparable coverage. As for international students, it is still required of you if you reside in the U.S., required of those that have requested immigration documents to arrive in the U.S. from the university. But there is an exception to this rule if you can show that you are enrolled in a U.S.-based group health insurance plan. Now, given the nature of COVID-19 and its impact on the world, on a case-by-case basis, international students may apply for an exception from the requirement if you are not residing in the United States for the fall 2020 semester, given that you can demonstrate comparable coverage in your home country. Domestic students that were granted a waiver or international students granted an exception for the fall 2020 term will be required to enroll in the university's student health insurance plan or request a waiver or exception for the spring 2021 term if classes are held on campus. So now let's dig into waiving the Columbia Student Health Insurance Plan. Eligible students who are automatically enrolled in the Columbia Student Health Insurance Plan may request to waive coverage by the deadline, September 30th, by completing the waiver form online in the MyTC portal. As a domestic student, if you plan on dropping below 12 billable credits and you're not living in the dorms, do not submit a waiver. Insurance and health fee will reverse off of your bill within 24 hours of you dropping. Again, all waivers are due September 30th, and a valid waiver request must be submitted during the fall semester each year you wish to waive. So just because you waived last year or just because you waived this year doesn't mean you don't have to waive next year. Columbia's criteria for waiving the insurance. So what is it that I mean when I say comparable coverage? Well, the plan must meet the requirements of the Affordable Care Act, including coverage for routine, urgent, and emergent care for all essential benefits in New York State. For a description of the ACA benefits, please see our Compare Your Coverage tool. And I've also listed a couple of resources that you can look into. Secondly, the plan must be effective and remain in force for the duration of the following schedule. And the plan must be licensed to do business in the United States. So again, this applies to domestic students. How do you apply for the waiver or for the exceptions to Columbia Student Health Insurance? If you have health insurance that meets Columbia University's criteria and would like to waive the Columbia plan, you can do so online through the MyTC portal. Please note that supporting documentation will have to be uploaded to the portal. Step-by-step instructions and how-to videos can be found on our website, www.tc.edu/health. As an international student, as of fall 2020 on a case-by-case basis, you will be allowed to apply for an exception to the Columbia University insurance via our website. You can request an application for an exception if you email us, but note that all supporting documentation has to be emailed to us in one email, if at all possible. And here are just some phone numbers for health services contact information. One number in particular to keep in mind, especially for those who will be on the Columbia Student Health Insurance Plan. The number at the bottom, customer service, 1-800-859-8471. Another number to keep in mind, counseling and psychological services, 212-854-2878. They're providing services via telehealth still. So just really briefly, some terms to know. Copays, the fee paid by this insurance student each time medical services used outside of Columbia Health. It does not contribute towards your out-of-pocket maximum. Co-insurance is the percentage of charges for covered students that you're required to pay. So for example, health insurance covers 80% of charges covered by a hospitalization, leaving you responsible for the other 20%. That 20% is known as the co-insurance, and this would count towards the out-of-pocket maximum. Preferred care is an Aetna student health provider, also known as someone who is within the network. You can go to the Find a Doctor link on the Aetna Student Health website. For non-preferred care, that refers to those who are outside of network, and that will cost you more if you see a doctor outside of network. Some other terms, a claim is a health insurance claims bill for healthcare services that your healthcare provider turns into the insurance company for payment. An explanation of benefits. Sometimes you may get this in the mail and think it's a bill, but it is not. It is clearly just an explanation of the benefits and how much Aetna has paid and things like that. Just immunization records. So there are 2 immunization requirements that all students, regardless of credit load, must meet in order to attend classes. So we follow New York State Public Health Laws 2165 and 2167. So in New York State Public Health Law 2165, it requires that all students born on or after January 1st, 1957 have to provide your documentation of immunity to measles, mumps, and rubella. New York State Public Health Law 2167 requires academic institutions to distribute information pertaining to the meningococcal disease vaccination to all students. Furthermore, all students are required to submit a response form as to the status of the meningococcal disease or meningitis. Students admitted for the summer and fall terms must submit their records on or before the first day of classes, which is September 2nd, 2020. Or again, if you will reside in TC residence, you have to provide that before you move in. Again, measles, mumps, and rubella, or MMR, for students who were born before January 1st, 1957, you're exempt from submitting documentations for MMR. And for those who would like to apply for religious or medical exemptions, all you have to do is contact us at health-immunization@tc.edu so that we can walk you through the process of exemption. But also, please keep in mind, exemptions have to be applied for every year. So just because you applied for it this year, you will have to reapply for the exemption again next year. So what do we deem as acceptable MMR records? Our teachers call it immunization form, which is available on our website. And this form must be signed and stamped by your healthcare provider. Or if you send us your undergraduate or previous graduate institution's form, please keep in mind, it has to be submitted on letterhead. If it's a handwritten document, it needs to be signed and stamped. If you send us a hospital or medical facility lab report or vaccination record, we'll accept them, faxed or a scanned copy of the original lab report, as long as it's printed out and placed on the facility's letterhead. Handwritten documents need to be signed and stamped. And lastly, you can send us a military vaccination record. So to submit your records, our preferred method is through the MyTC portal. You can also mail them to us, or you can fax them. The meningitis response. So the meningitis vaccination is not required. However, students are required to either select that they've received the meningitis vaccination within the past 5 years and provide the date and proof of vaccination. 2, you can select that you acknowledge that you've been informed of and understand the risks of the meningococcal disease and will receive vaccination within 30 days. Or lastly, you can select that you acknowledge that you've been informed of and understand the risks of the meningococcal disease, but you're declining vaccination. So how do you submit your meningitis response? You can just do it online through the MyTC portal. How do you submit your meningitis response? You can easily do so through the MyTC portal under Student Resources, then Student Records, Enrollment Services, and then on the meningitis vaccination request form. If you had the meningitis vaccine, you could upload proof of vaccination via the TC portal, the same way you upload a copy of your immunization records. If you want a copy of your records, you can now access your immunization records through the MyTC portal as well by following the instructions on our website. Proof of vaccinations received at Columbia Health can be retrieved from them by calling 212-854-2284. And that concludes my presentation. I will be open to any questions anyone may have. However, in the event that you have a question outside of what was mentioned today, or you couldn't think of something today, please feel free to reach out to us at health-immunization@tc.edu. Thank you.